world's poor by developed nations. And where the subject of sexual and reproductive rights is concerned, our failure speaks to the abject neglect of basic human rights of the world's peoples. Each year, another 24 million young women enter their reproductive years. Sadly, many young women will be forced into marriage and motherhood at an age when most girls in developed countries are just entering secondary school. Today, lack of access to sexual and reproductive health services and information is the leading cause of ill health and death for women of reproductive age. Pregnancy and childbirth-related causes, including unsafe abortions, are the major cause of death for young women aged 15 to 19. They are 5 times more likely to die from pregnancy-related complications than women in their 20s. 5 times more likely. Those who survive are often robbed of their potential, suffering disabilities such as fistula that in a country like Canada would never happen. Girls who are married young or who become mothers at a young age are less likely to finish school than their peers who wait until after their 20th birthday. Less education, young women face limited employment and diminished earning potential. For many young women, leaving school is not their choice. Becoming a teenage mother is often not a matter of choice for them either. In some societies, marriage and motherhood are equated with female status and worth. There's tremendous pressure to marry young and have children at an early age, or to prove fertility by having a child before marriage. Gender inequality and discrimination often means that young women have little choice about whether or not to have sexual relations, when or whom or whether to marry, or whether to use contraception, provided it's even available to them. Around the world, adolescent girls and boys lack adequate knowledge and facts about reproduction, sexuality, family planning, and health. And I include Canada in that equation, as we've heard over the last few days. We all know that research indicates that sexuality education encourages responsible sexual behavior, including higher levels of abstinence, a delayed start of sexual activity, fewer sexual partners overall, and a reduction in STIs. One of the landmarks achieved at the 1994 Cairo Conference was the formal recognition that adolescents have sexual and reproductive health needs distinct from those of adults, and that they have the right to sexual and reproductive health information and services. These rights include access to comprehensive information and services, awareness about STIs, education about gender equality, and shared responsibility in the matters of sexuality and education. Cairo also recognized that young people have the right to privacy, confidentiality, respect, and informed consent. 1994. International recognition is one thing. Transforming that recognition into action is something else again. Around the world, many barriers still exist to meeting the unique needs of adolescents. Often services are not provided at all, and when they are, they frequently do not include young people in their design or their implementation. Often the services offered are neither confidential or non-judgmental. Providing sexuality education through the school system can be effective for those young people who are in school. But how does that address the needs of those adolescents who are not enrolled in school? In many developing countries, students represent the minority of young people. There are far more young people, especially girls, out of school than their peers in school. Complicating the situation further is the reality that the gender gap in education is biggest in secondary schools. Around the world, many teenage girls are not in school to benefit from the few programs that are in place. Reaching young people is essential if we hope to assure their health and secure a healthy, productive future for their children. It's also essential if we have any hope at all of eradicating poverty. Poor sexual and reproductive health perpetuates poverty by affecting those in the prime of their economically productive lives, and it has a greatest impact on those who are most vulnerable. Each year, it's estimated that 250 million years of productive life are lost to death or disability related to poor sexual and reproductive health. What's more, when girls are allowed to complete their education, they make good choices for themselves and their children, as we all know. The children are more likely to be healthy, better fed, and better educated. If allowed to choose the number and spacing of their children, the women themselves are more likely to be employed, more likely to participate fully in their communities, and more likely to become the agents of change that development requires. It's simplistic, far too simplistic and easy to correlate sexual and reproductive rights only to contraception and abortion. Yes, women need the means to make their own choices and control when, how, and with whom they have children, but sexual and reproductive rights have a broader, far-reaching impact on poverty, health, education, and development. And we must not reduce this complex, interrelated issue into a simple formula that fits someone's political agenda. If we want a reductive formula, consider this. When women are denied access to reproductive health and contraception, illegal and unsafe abortion is often their only option. And as a result, fully 8 million women and girls require treatment for serious complications resulting from unsafe abortion. Now, of that 8 million, 3 million receive no assistance whatsoever. So refusing to discuss abortion is not an answer for these girls and young women. So let's talk about Canada's role. Last year, as host of the 2010 G8 and G20 summits, our then Prime Minister Stephen Harper chose to highlight maternal and child health. It was a laudable move, but the question remains exactly how did the then, at least I hope the then, Prime Minister, now demonstrate leadership on this issue. So what did he do? He pledged $1 billion for maternal and child health programs. Laudable. But where are sexual and reproductive health and reproductive rights on Prime Minister Stephen Harper's agenda? So far, family planning completely eliminated, absent from any initiative under the G8 maternal health program. And of course, he has said abortion will not be part of that initiative. And as we've heard in the media last week, funding for International Planned Parenthood Federation has been stalled since June 2009. Its current application of May 2010 has been languishing on the minister's desk ever since last May. So 1 year tomorrow. No, our Prime Minister prefers to talk about the need for clean water and vaccines. Needless to say, access to clean water and vaccines are vital, but we have to be very clear. By ignoring family planning, Canada is dooming women and children in developing countries to continued danger of ill health or death. By not funding abortion, even in countries where it is legal, women are subject to discrimination that could cost them their lives. And I point out that abortion is banned in just 4 countries: Malta, Ireland, Nicaragua, and the Dominican Republic. In every other country in the world, abortion is permitted at least to save the life of the woman. And I would also point out that the UN Human Rights Council has condemned maternal mortality as a pressing human rights concern, violating women's rights to life, health, equality, and non-discrimination. The first time this happened was just 2 years ago, and I'm very delighted to say that ACPD's Human Rights Advisor and Director of International Human Rights Advocacy, Sandeep Prasad, was instrumental in taking that role forward. He's now ACPD's new Executive Director. So, are we wasting the money committed by Prime Minister Harper by refusing to look at the larger picture? I'd answer yes, we are. Are we ignoring our own pledge to the MPGs? Yes, we are. The fifth MDG, to include maternal health, cannot be isolated without consequence. It's not only about reducing maternal deaths, it's also about improving the reproductive health and quality of life for women in the years before they can become mothers, throughout their adult years. Seeing women as baby makers is short-sighted and it's insulting to women. It's about empowering girls and women by giving them the freedom to exercise their sexual and reproductive rights. Some of our global neighbors understand this better than we do. At the MDG summit last September, Danish Prime Minister said, "Women are agents of development. There's no chance whatsoever of achieving MDGs without strength and focus on the empowerment of women. Women must be able to decide freely if and when they want to have children and must have access to health services while giving birth." If Canada is to meet the commitment it made in 2000, it needs to do more than contribute toward clean water and vaccination programs. We need to embrace the MDGs in their totality, move beyond simply cherry-picking parts of the program that fit our government's political agendas. Today, our government likes to point out Canada's success in weathering the global economic storm. And it's true that effective governance of our lending institutions has improved our financial standing in the world. But that just throws it into even starker contrast how well off we are. As one of the world's wealthiest nations, we simply cannot rest on our good fortune and ignore realities that are uncomfortable to face. We cannot deny girls and women that which should be their birthright: freedom, rights, health, and a chance to make a difference in their future and in the future of their communities. Although I've focused on the global picture, I'd like to mention also that there is a great need not to be complacent about the situation in Canada. While contraception and abortion are legal in Canada, as we have heard repeatedly over the last 3 days, they are not always easily accessible, especially for women in remote communities and for youth. There are many people, including many politicians, who would be happy to limit or reduce access to legal safe abortion services and family planning in Canada. Our government's international position is a reflection of their ideology and provides us with a warning of how they would like to shape policy in Canada. Only 21 countries are on track to reach the MDG target of reducing maternal deaths by 75% by 2015. Every year, 340,000 women die from complications relating to pregnancy and childbirth, including abortion. That's 39 women every day, many of them in their early teens. 48,000 women die every year from unsafe abortion, according to the World Health Organization. That's far too many. Each one of those deaths is preventable. We've seen a 35% decline since 1980 in the number of maternal deaths, which at that time was over 500,000 women every year. Now, though that's encouraging, it simply is not enough. If we're serious about change, if we are serious about ending poverty, if we truly want our investment to have an impact, we must embrace a holistic approach to development. We must recognize that women's sexual and reproductive rights are indivisible from the other development goals that we are committed to. Strong investment in comprehensive reproductive health services is necessary to accelerate progress on all of the MDGs, not just the ones related to child mortality and maternal health. Protection of all human rights is paramount to achieving the bold promise made at the turn of the millennium. Were we serious? Do we still mean it? Are we going to break our promise? If we truly want to end poverty, we must act, and act with determination. Please vote accordingly. Thank you.